Welcome to another module of the online education program. In this module, you will learn about hypoglycemia. Experiencing a hypoglycemic event where you need third-party attention or have to be admitted to the hospital has severe impact on the quality of life of all our patients. The patient will do everything he can to avoid this. This, unfortunately, for some patients means to skip diabetes therapy or, unfortunately, to accept high glucose values. This is the start of a devil's circle because higher glucose values finally lead to many complications associated with diabetes. The problem is that these complications are still far away for the patient, but the hypoglycemia, on the other hand, is very present today. What does this mean for us? Three things are important. On one side, we should educate our patients to do whatever is possible to avoid hypoglycemia. On the other hand, we should enable a medical treatment which has a very low risk of hypoglycemia. Furthermore, we should encourage the patient to perform a good self-management in order to have good control about his or her blood sugar. For the medical treatment, this means using, for example, drugs which have a very low risk of hypoglycemia, like, for example, SGLT2 inhibitors. In the case the patient needs insulin treatment, he should measure blood sugar on a regular basis. What can the patient do? Firstly, the patient has to use accurate glucometers to measure his blood sugar regularly to identify symptoms of hypoglycemia as early as possible. Studies show that the more accurate the glucometer is, the better the patient is able to detect the risk of hypoglycemia. Modern glucometers already give a warning if a hypoglycemic event may occur in the near future. The second step, which is important for the patient to learn, is how to deal with early signs of hypoglycemia. Knowing and perceiving these symptoms of a mild hypoglycemia and acting on it helps to avoid a severe hypoglycemic event. Studies show that mild hypoglycemias are much more common than we may believe. It is worth to avoid hypoglycemia because having such periods redundantly significantly increase the risk for diabetes-associated complications, similar to high blood sugar levels. So it is important to find a good corridor between avoiding hypoglycemia but also avoiding high glucose levels. The take-home messages for these modules are: firstly, it is very important to recommend your patient to measure blood sugar by using accurate glucometers. It is even better to use glucometers who give a warning about a hypoglycemic event. Secondly, it is important to encourage your patient to really make use of this glucometer and measure blood sugar on a regular basis. Finally, it is important that the patient knows and perceives the symptoms of hypoglycemia. This can be learned, and it is important to the patient to know how to act immediately on it. Avoiding hypoglycemia will significantly impact the quality of life of our patients.